Good afternoon, everyone. Thank you for your patience and flexibility. We will be starting our update with Director Christ in just one moment. We are enabling everyone to record, and this is a reminder that today's session is on the record. Please feel free to record. After Director Christ's presentation, please raise your hand through Zoom and we'll call on you to ask questions. And with that, I'll turn it over to Dr. Christ.
Good afternoon, everyone. Thank you for joining us today. I'm Dr. Cara Christ, the Director of the Arizona Department of Health Services, and I hope everyone had a very nice holiday weekend and is looking forward to the new year. This past week, we've seen the ongoing rollout of the COVID-19 vaccine to our healthcare workers and vulnerable populations. As we continue to get vaccine into the state, we will expand the number of places and providers who are administering vaccine and increase our communications about who is eligible and where individuals can get vaccine. As we head into New Year's Eve, I want to remind everybody that when people get together, parties and social gatherings are high risk for COVID-19 transmission. Our cases remain elevated, as does our percent positivity, and we continue to see increased hospitalizations and deaths. Our COVID-like illness continues to show high use of emergency room and inpatient beds. So you're always safest around members of your immediate household. That's why I strongly recommend welcoming the new year with just those people. As an alternative to a larger gathering, please consider using Zoom or a similar platform to have a virtual party. And if you do decide to gather with others at your home or elsewhere, be aware that you're taking on the risk that somebody close to you will transmit COVID-19. This can occur even if someone doesn't have symptoms. So we always want to make sure that we're taking precautions about around people who aren't members of your household. We're seeing far too many cases of people getting COVID-19 because they let down their guard at a gathering with friends and family they trust. So my team at ADHS continues to update our plan for Arizona as new vaccines are approved and we learn more from our federal partners. Today I want to provide an update on the distribution of vaccine and some updated information. I will provide a brief presentation as I have the past few weeks and leave time at the end for questions. I'd like to take you, I'm going to start a little bit differently today. I'd like to take you through some of our most recent data to point out what we're seeing here in Arizona. Cases in Arizona are elevated currently. However, we're not seeing the dramatic week-to-week increases we saw around Thanksgiving. Although, unfortunately, we do anticipate seeing an increase in cases about a week to two after the Christmas holiday. We continue to monitor our cases and the data. This chart, which is also included in our weekly PDFs, shows the cases over time with our mitigation measures overlaid. So you can see here that a majority of our mitigation measures that were implemented over the summer are still in place in Arizona, and that is all of the mitigation strategies that are listed in red on that chart are the mitigation strategies that are still in place. I also want to share our percent positivity chart with you, and you'll see that this chart looks slightly different than what's on our dashboard. This chart shows the total number of diagnostic tests conducted in Arizona over time, not just the number of unique individuals tested. So on our summary dashboard and on our main laboratory tab, we show the data just of unique people tested, but we have far more tests that repeat people have had done than we had in the past. If you look at the data, the dark gray bar shows the number of Arizonans who have never been tested before, and the light gray bar shows the number of Arizonans who are returning for testing. The percent positivity, while still increasing, is lower when you look at the total number of diagnostic tests conducted rather than only the number of tests conducted for unique individuals. Now I'll provide some updates on COVID-19 vaccine and the implementation of the vaccination program here in Arizona. So based on current information, Pfizer and Moderna vaccine is currently being administered in Arizona under the emergency use authorizations approved by the FDA. We have heard announcements about the United Kingdom approval of AstraZeneca vaccine. At this time, our understanding is that the US approval of this vaccine isn't expected until late winter. Last week, when the Moderna emergency use authorization was approved, they made a recommendation based on national data that older Americans and Arizonans are far more likely to experience severe COVID-19 complications and be hospitalized than younger individuals. Those 75 years of age and older are 8 times more likely to be hospitalized and 220 times more likely to die compared to younger adults. These risks continue to significantly increase for individuals 85 and older. Based on this information, last week, the Advisory Committee on Immunization Practices at the Centers for Disease Control and Prevention made the recommendation that those that are 75 and above should be vaccinated in phase 1B. And then based on that recommendation, we updated the recommendation in Arizona for prioritization of vaccine. What that looks like, if you look at the slide, the red box that's highlighted under phase 1B, Arizonans 75 and older are now prioritized to be vaccinated against COVID-19 in the prioritized phase 1B, along with our education and childcare services and protective services occupations, which include law enforcement and fire. This recommendation by the Arizona Vaccine and Antiviral Prioritization Advisory Committee is intended to protect those who are most at risk for severe outcomes due to COVID-19, such as hospitalization and death, and to reduce strain on Arizona's hospital by allowing them access to vaccine earlier. This recommendation is aligned with the updated recommendations from the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. This PDF, this infographic, can be found on our website if you are interested, and we update that as recommendations get updated. So quickly, I'll go over a general overview of Arizona's vaccine distribution system. Arizona currently utilizes a local allocator model for vaccine distribution, with the local partners as the backbone of the vaccine program implementation on the ground. So initially, our federal partners announce the number of doses that are available for the state to order in a given week. The state then divides this allocation among the various local health partners based on the priority population within that jurisdiction. Then the local health partner, which we refer to as the local allocator, uses an ADHS developed allocation tool to place vaccine orders of their allocated doses. The local allocator uses this tool to specify the number of doses they would like sent to each pre-designated vaccine provider. ADHS then collects all of the local orders and places the Arizona order for vaccine with the federal government, communicating how many doses should be shipped to each location based on the local allocator orders. Finally, the federal vaccine partners directly ship that vaccine to the vaccine provider who will be administering the vaccine. As vaccine becomes more widely available, local allocators will no longer need to place jurisdiction-wide orders, and the vaccine providers will be able to order directly through the ADHS ordering system the way that they do for routine vaccines. In December, initially, when we were given a look ahead of the vaccine availability, we were projected to receive a total of 384,350 doses of COVID-19 vaccine. Our final December total equaled 750 doses. These have been confirmed, and you can see the breakdown of those doses for each week in December. This week, Pfizer doses were distributed to Maricopa and Pima counties, and all 15 counties received doses of Moderna. All counties are actively vaccinating their phase 1A populations. And next week, in addition to more doses of Pfizer and Moderna vaccine, we expect to receive the additional second doses of Pfizer vaccine so that we can start vaccinating those who have received their first dose during that initial week that we had vaccination available. Here you can see the number of doses that are allocated to each county for this week. So again, we have all 15 counties are local allocators, and then as well, we do have some tribes that have opted to receive vaccine through the state's allocation versus the federal IHS system. And so you can see all of the vaccine allocation for the week of December 27th. So initial phase 1A vaccination sites are open for frontline healthcare and EMS providers, and that started December 17th. We currently have over 70 large-scale vaccination sites that have kicked off their initial campaign. That's because vaccine supply is still limited across all counties. But we have over 650 providers who have been approved and are eligible to receive vaccine when additional supplies become available. And notably, this week, the CDC, Walgreens, and CVS partnership began vaccinations in skilled nursing facilities. So to date, over 2,000 long-term care facilities, that includes our skilled nursing facilities, our assisted living facilities, and group homes that have signed up for on-site clinics for residents and staff. In Arizona, we have designated our long-term care facilities as a priority. So the CDC, to remind everybody, has partnered with Walgreens and CVS and other pharmacy chains to support the vaccination of staff and the residents in long-term care facilities. And this does include skilled nursing facilities and assisted living facilities. That partnership allows the staff and residents at these facilities to be vaccinated on site within their facilities, so they do not need to go to a community site. We activated the long-term care program for skilled nursing facilities only at this time, and we are using the Moderna vaccine for this project. We will be continuing to evaluate the available data and or available vaccine to ensure that our skilled nursing facilities are getting vaccinated and to determine when it is time to move on to the next group of long-term care facilities, which would include assisted living facilities. And we'll be working closely with our county health departments to determine if there are any gaps in coverage or if there are sites that did not sign up that need priority vaccination. Approximately 20% of Arizona's phase 1A population has been vaccinated with the first dose. We've had approximately 57,000 out of 274,500 healthcare and first responders in Arizona vaccinated. As we look at the phase approach, this number will continue to increase significantly. So for phase 1A, for non-long-term care facilities, we work with the local jurisdiction to establish their initial vaccine sites, and that's been in partnership with local providers. As we've started to vaccinate, regional sites are operational to provide vaccine for healthcare workers in the phase 1A priority groups. For example, Maricopa County has activated 5 regional points of dispensing or pod sites throughout the county for phase 1A groups. Maricopa County has made pre-screening tools available for providers who are interested in being vaccinated. After evaluation of the information in the pre-screening tool, the county follows up with individuals to direct them to a site to schedule their vaccination appointment. PEMA has activated 2 pod sites to provide centralized vaccination for phase 1A populations and has begun to distribute vaccine to other county providers. Additional counties have a varying process for vaccinating phase 1A populations. For example, some jurisdictions conduct direct outreach to providers to invite them to schedule appointments at specified locations. Others are allocating directly to hospitals and other large provider sites so that they can vaccinate their employees. As the state opens up vaccine eligibility to phase 1B populations, prioritization and vaccination strategies will start to look different. While there may be some large regional vaccination sites, we likely will be adding employer-based vaccine clinics for essential worker populations and coordinating with local clinics and pharmacies that serve high-risk groups. Employers of essential workers are encouraged to complete the form on the ADHS website to support enhanced planning with their local county in preparation for phase 1B vaccination. And ADHS is currently working with local allocators on strategies to vaccinate the 75 and older population. While many of these individuals may be vaccinated during phase 1A through the Long-Term Care Facility Pharmacy Partnership Program, many additional Arizona seniors will be covered during phase 1B. We are planning with our local and state partners to identify mobile vaccination strategies for homebound individuals. And we are in discussions with CDC about activating their retail pharmacy partnership program, which would allow doses to be allocated to pharmacies throughout the state for older adults to be vaccinated at these locations. And during phase 1C, when vaccination is more widely available to the general population, more healthcare providers in the community will be allocated doses of vaccine, which will further expand accessibility of vaccination. Local jurisdictions may have an array of mechanisms to communicate with community members about eligibility for vaccine and where the vaccine locations are located. ADHS is going to be placing this information about vaccine websites on our website, very similar to how we display information about our COVID-19 testing sites. And we will clearly communicate the vaccination phase the state as a whole is in. We will be posting vaccine locations on vaccinefinder.org and on our website at azhealth.gov/COVID-19 vaccine. And we're coordinating with Arizona Poison and Drug Information Centers and 211 to provide them with information to answer and provide information for calls from the public and healthcare providers about vaccine. So Bloomberg has established a Bloomberg vaccine tracker. We've been working with them to get the numbers correctly updated, as they had been showing a much lower rate of vaccination for Arizona. So today we were able to update them, and we will be providing them with current data on a daily basis. They are still showing a little bit behind where we are in Arizona. So for 12/30, they're showing Arizona to be at 445,803. Our Arizona data shows that we are at 57,025. And so we will continue to work with them to make sure that accurate data is displayed. And with that, I'm happy to take any questions.
So, please raise your hand in the chat if you are on Zoom, if you'd like to be called on. And Director, our first question is from Howie Fisher. Hang on a second, Howie. You're all set.
Hi.
Good afternoon, Doctor. Glad we're finally getting this show on the road here. One thing you said about the department's going to be announcing what stage we're in on its website. Are all counties necessarily going to be in the same stage, or might you get to a point where Pima County is ready for 1B or 1C before Maricopa or Graham? I mean, is this a statewide issue or what?
So yes, so we will be putting, from a statewide perspective, what phase the majority of the state is still in. However, we will be working with the county health departments to have what phase each county is specifically in on our website as well as displayed on their websites.
Well, this is critical because when I wrote the story earlier this week about, people 75 and older and then started getting questions from folks, I mean, the questions that we keep getting is, how are people supposed to know when to line up? I mean, if you're 65 plus, you can show up with a driver's license or something like that. If you have an underlying medical condition, do you need a note from the doctor? Where do you have to sign up? I mean, these are the details I think that our readers and viewers need. And so far, there doesn't seem to be much there. We're mainly talking about the frontline workers, but we're not talking about what do individual citizens need to do.
So that's a great question, Howie. So we are working on getting that information onto our website, as well as locations where we will expand access. We are looking at partnering with statewide partners such as pharmacies to increase that access. When we move into phase 1B, we will be disseminating information so that everyone knows that we are in phase 1B and where to go to get vaccinated. With the age, it will likely just require a driver's license to prove age. For essential workers, it would likely require either you attend an employer-based vaccination site, or if you were going to a pharmacy or using a retail outlet or your physician, you would need to show a badge or some type of proof that you were one of the essential employees listed. We will be starting with our over 75 years old and our education and child care providers, as well as our law enforcement and police departments. So we'll be working to get those informations out through established channels that we have. As we move on through the groups, we understand that it's going to be harder to prove that you are one of those groups. We don't expect at this time to require people to bring proof of their medical condition if they are in that phase 1C group. But likely at that point, we will be working with individual providers that treat some of those more higher risk patients to get them vaccinated, or to get those people to to vaccination locations. But yes, as we keep adding things, it's going to get more difficult to prove that you're one of those groups.
And finally, do you believe the system that's set up is working or needs major revision? I got some feelings from talking to folks in the Ducey administration that they wanted some wholesale revisions in how we're doing this. So do we need major changes, or are we just tweaking, or what are we doing here?
So what we're going to be looking at is establishing kind of that statewide network. So we have been working with our county health departments as local allocators. What we're identifying is that there is a need for a statewide approach, especially when you're dealing with CVS and Walgreens, that can't take a county by county approach. So you will start to see that we will be engaging those statewide partners and making it more consistent across the state on how people find out how to get vaccinated, where to get vaccinated, and when to get vaccinated.
Fair enough, thank you.
Next up is Dennis Welch. I will unmute you.
Hi, Dennis.
Hang on.
Oh,
Here you go.
How are you, Dr. Chris? I just want to kind of switch gears a little bit today. This morning you announced on Casey Family that there's going to be 300 more nurses coming to the state next week to help out, and so it seems to be critical right now as we're seeing hospitalizations. Hospitals at capacity right now. Earlier in the month, the governor said he was allocating $60 million to hire 500 nurses by the end of this month. So my basic question is, how can we get that goal?
yeah, absolutely. So this is part of a multi-pronged strategy. Through the end of January, we will actually be bringing in about 820 to 900 nurses in total. So nurses have been arriving week by week, but our largest bolus is definitely next week, with over 300 nurses scheduled to arrive to Arizona hospitals. We also have a federal medical request that is arriving this week to the Yuma area. And so we are starting to see increased staffing come in, because we know our hospitals have done a fantastic job at increasing their surge capacity so that they have the beds, they have the space, they have the ventilators. And what we're identifying, like the rest of the country, is the barrier now is staffing. And so trying to get those additional staff in so that we can continue to take care of Arizonans is really important.
So this is, just to be clear, this is the first wave of bolus of the nurses, this 300, can you also tell me, are these all from out of state?
Yes, so the contract that we've been working with is they are supposed to be pulling people from out of state. We specifically did not want them to recruit in-state nurses. That's the biggest bolus, but I believe that we had like 80 come in last week, 50 come in the week before, but we've had various numbers coming in week by week.
Thank you.
Welcome.
Next up is Eric Fink from Tucson.
Hi, Eric.
Hey, Dr. Christ, how are you?
I'm good, how are you?
Good, thank you. Just to kind of add to Howie's line of questioning on the vaccine. So with this, two questions. The first is with the 75 and older group now, the big question I think we're getting in the first day and plus at the announcement is where can I go? Do I have to go to a hospital? Is it going to be through CVS and Walgreens? I know you touched on that a little bit, but are we going to have more sites stood up so we can get that administered? The second question is, there seems to be really across the country a slow rollout here, a bit of a rocky, slow rollout. What are your concerns right now, and how do you expect to try to alleviate that going forward into the new year?
Those are great questions. So what we're trying to do is to offer a variety of settings where when we hit phase 1B, people can go to get vaccinated. So it won't just be the CVS Walgreens, but that would be a choice. We also anticipate still having some of the mass vaccination pods open to allow for those phase 1B workers, as well as mobile vaccination clinics that we can take to people's homes or to facilities, as well as rapid response teams that can go out, and then as well as trying to get to employers like SRP or those large employers that have a large number of essential employees. We will be posting on our website at the start of next week a form where individuals who are 75 years and above or their daughters and sons can go register so that they can receive updated information. We're also planning on having a call-in line in case people aren't comfortable using the internet to provide that information so that they can get notified when it is ready and we're aware that they are out there and can ensure that they get vaccinated. On the other one, some of the concerns, as we're watching around the country, this is a monumental task that public health has not, we do vaccination all the time, but this is the vaccination of the entire population. And so while the vaccine is still coming in and limited, it is going to seem like it's moving very, very slowly. Our pods, we're getting used to identifying the healthcare workers, making sure that they were healthcare workers for the most part, trying to keep those going. What you will see this coming week is a large increase in vaccination. So this week was the first week that our skilled nursing facilities were being vaccinated. That is large numbers of people all at the same time. They anticipate getting through our 146 skilled nursing facilities within 3 weeks. And so that will significantly increase those numbers. And Maricopa County has been working diligently to ensure that all of the spots at the vaccination pods or all of the appointment slots are filled. And so as we approach this next week, you will see increased numbers going through our pods as well. So we continue to learn, but we also have identified that we need additional locations where people can go get vaccinated versus just having a few smaller areas to go get vaccinated.
Just one quick follow-up to that. I was just on a call with Dr. Terry Cullen down here in Pima County. She says she's working with you guys to be able to provide more county administrators, more administrators for the vaccine. Right now, is the vaccine only being administered down here at both TNC and Banner?
So right now, the vaccine at those is being administered centrally at one of those 2 locations. And the county health department is working very closely to ensure that that your healthcare workers down in the Pima County area have access. Now, there are a couple of other federal sites that are vaccinating, such as the Veterans Administration or Indian Health Services, they have been continuing to vaccinate their patients and their healthcare workers. So you may hear that VA employees or IHS employees or their patients have gotten vaccinated as well.
Thank you very much, Dr. Chris. Appreciate your time.
The next question is from Bob Christie.
Hi, Bob.
Hi, Dr. Chris. Hey, so we started out December 4th expecting 383,000 doses. That's now been revised down. I know why that happened. But what struck me with what you said today is we will have by the end of this week 314,000 doses, not for 314,000 people. They're holding back the second dose, right?
Right, yeah, so those are all first doses.
Right, all first doses by the end of this week. You've only injected 57,000 people. That's only 20% of your available doses. What the heck's going on? I mean, why aren't you in the middle and in arms? Why are we 2 or 3 weeks behind?
So
I mean, that's people who may die because they didn't get the vaccine.
So we continue to increase.
That's my question.
Yeah, no, that's good. Thank you, Bob. So we continue to
All right.
increase the access to vaccination. 20% of those healthcare workers, we do want to try and get to 100% within the next few weeks so that we can move on to that phase. We know we'll never reach 100%, but as our appointments now have filled up, and keep in mind, it just expanded to the rest of the state just last week. And so they're getting their sites up and going, and pretty soon we'll be operating at a full tilt as well. So it is our goal to get the vaccine into arms of Arizonans as quickly as possible.
Right, but you're not. It doesn't appear you were prepared to. I mean, if you've been sitting on, 100,000 doses for more than a week and a half, that means you weren't prepared to give it, and you knew it was coming.
So we are working with our local health departments to look at ways to increase that vaccine. Some of that vaccine just came in a couple of days ago, so it's constantly coming in and going out, but we're working on getting additional vaccine out.
So you don't see that as a problem?
Looking across the country, we're not last, we're not in the last group. I think everyone is figuring this out as we go. And so we will continue to make improvements and identify new opportunities as we continue to move forward.
Okay, thanks, Todd.
Thanks, Bob.
Next is Nicole Gregg.
Hi, Nicole.
Hi, Dr. Christ. I'm doing this on my cell phone, so can you hear me?
Yes, I can.
Okay, just making sure. Kind of following up on, what was just asked. Like, we have over 250,000 tests sitting there right now. I think it's more actually like 18% is what we've administered. I just don't understand, what are you going to do to get them out quicker? And are you okay with how many have, already been administered?
Yeah, thanks, Nicole. I think, our county health departments have been working continuously to get this vaccine out. Of course, we would always like all of the vaccine to go out as quickly as it is coming in. I mean, our goal is to get Arizonans vaccinated. So we'll never be satisfied with where we are until it is all distributed. But we are working with our local health departments to expand the access. We were really trying to make sure that we got it to those frontline workers, which required a little bit more of a triage process at first, because we wanted to make sure we were getting it to them. Now we've opened up to all phase 1A healthcare workers, and so you will see that that's going to start increasing significantly.
Okay, and then my second question, there was kind of dueling press conferences, so I got in a little late. Maricopa County was having one, you started yours, and I'm learning through that little presser that there are different systems. So Dignity and Abrazo, for example, kind of go through one system after pre-screening, and then Banner basically created their own. And it just seems like there's not like a uniformed approach. So there's different ways to pre-screen and then go through the process in the computer. Is that an issue? And to Holly's question, are you going to take over all distribution then? you know, you said something along the lines of we're going to look at a statewide network. What did you mean? Are you going to take over from all the counties?
So what we're looking at is taking a more of a state-directed approach for allocation. So really looking at our county health departments really know their community providers the best. But knowing that some of those more statewide entities like the Walgreens, the Costco's, the CVS's, they need to work on a statewide basis. We'll be allocating some of the vaccine directly to them as it becomes available. So taking a look at that, but we agree with you. We don't want to mandate that anybody use one specific system because it's, while we do have a state system that's free for any provider who wants to use it, they can use it. We also know that like Banner has an EHR that needs to interface with their scheduler. And so as long as it's compatible and provides a scheduler, we're fine with them using it. But it does need to be in one place, and we need to have all of the testing sites accessible in one location for Arizonans. So that's something that we're going to be working on. Very similar to how our testing site works, where you can go find a location, and then you can link to the Walgreens registration for testing, or you can go to ASU's saliva-based testing. It will be that kind of format. So if you find a location where you want to go, you will have access to their registration system. So it will seem less confusing and less disjointed. Sorry, I'm looking at Steve.
Okay. Jeremy Duda is next.
Hi, Jeremy.
Dr. Christ?
How are you today?
As I'm sure you were with us, I'm good. How are you?
I'm good.
The governor's office just announced a new executive order from Governor Ducey to streamline the vaccination distribution process, looking at kind of more of a, looks like kind of more like a top-down model from the state. Can you elaborate on exactly how this will change the process that we're looking at now?
Yeah, absolutely. So this kind of goes back to my answer with Nicole. So we are looking at having a more streamlined statewide approach. We have always worked in Arizona. Arizona is a home rule state where the counties are the local experts and know their providers the best. But what we've identified is there's a need to rapidly expand access to those or to those vaccination sites, as well as working with their statewide providers. We want people to know that when Walgreens has vaccine, it's going to be Walgreens across the state and not just the Walgreens in Maricopa or Pima County, and really have a consistent approach so people know where to get the information about when they should get vaccinated, where they should get vaccinated, and so that we can target those very vulnerable, high-risk populations and get them done quickly.
There's been more a problem of getting the information out to people. Has that really been kind of the holdup here?
So it's been a couple of things. So we do know that each county's doing it a little bit differently with how they're getting information out. That needs to be streamlined because that has caused some confusion. We also want to make sure that we are rapidly expanding to ensure that there are a number of additional sites where people can go and where healthcare providers can get vaccinated. So it's going to involve the state being able to take a portion of the allocation of doses. Currently, we had only kept a little bit for like state employees that we would have to do a pod for, or to get them to some of our state agency partners. But now we would be able to directly allocate off the top to pharmacy chains if that was something that we wanted to go with, or to FQHCs, or federally qualified health centers, so that they could start vaccinating and getting it out to those high-risk populations.
Okay, so has the county-based, was it kind of a mistake to start with a county-based model? It sounds like, I think we're all hearing that, especially with Maricopa, that's been kind of there've been problems of distribution here in Maricopa County.
No, I don't think it was a mistake. I think as we've learned about the pod distribution, Maricopa County and their partners have done a fantastic job at getting those phase 1A people in and getting their appointments. What we've identified is working with some of those other providers that have a statewide presence. They can't just work with one county or another, which is what we thought they would be able to do. We want to make sure that we've got vaccine available from a statewide perspective in as many places as we can. So
Yeah,
we're still going to work with our counties on getting the vaccine to where they feel it's needed most.
Okay, and one other quick question, just a kind of a side note here. What is the state's plans for vaccinating inmates in the Department of Corrections? These are folks who are obviously at very high risk, crammed together, kind of overlooked a lot. What's the plan for that?
Yeah, absolutely. So we've been working very closely with ADCRR to establish that. So all correctional facility employees and inmates will at least be vaccinated in phase 1C. But we also know that some of them are going to have high-risk medical conditions. Some of them are going to have characteristics that make them more vulnerable to bad outcomes from COVID-19. Some of them participate in activities that may make them more vulnerable. So we'll be working with the Department of Corrections to review like inmates individually to identify if they meet the high-risk medical condition requirement, which would be in phase 1B, if they're over 75, which would be in the prioritized phase 1B, to get them vaccinated early. And our correctional officers are all included in the protective services prioritized phase 1B.
Thank you, Dr. Christ.
Yeah, absolutely.
Next up is Vaughn Hilliard.
Hi, Vaughn. I don't hear you.
Hang on, sorry, Vaughn.
Hello.
Oh, hi.
Hey.
Okay.
Thank you. I think I'm unmuted now. Hello. My question here is kind of more along the operational lines. You were talking about 650 providers here, and I know that there's an HHS program that was going to be working with the 19 different pharmaceutical networks here. And so when we're talking about Walgreens, have you, to what extent have you spoken with them in which they're operationally prepared to take on a larger role here? And, you know, because if we're talking about the 650 providers, a great number of those, to my understanding, would be, you know, basic regular doctor's offices. And, you know, and to what extent are you looking at other, like, expansion of the pods? Because it's hard enough to see some of the shadows of the summer and an inability or frustration of folks to go from, you know, one CVS location and be unable to register. And especially when we're talking about the phase 1 population, which the state and local governments are responsible for overseeing, to what extent do you see that there is more of that, that CVS or a Walgreens could take on a larger capacity than perhaps just a few locations?
Yeah, absolutely. So they have been working with the federal government to implement the long-term care partnership, but they also have been establishing a retail-based pharmacy partnership where the states can work directly with them to allocate vaccine. We actually have been reached out to by some of our pharmacy partners asking if they can utilize some of the vaccine that would potentially go to waste to vaccinate their frontline workers and other frontline workers. So basically asking to get into the vaccination game here. We are working to identify, so they had to register and onboard, this is getting really technical, but they had to register and onboard with the federal partners, which we should be able to utilize when we work with the retail pharmacy partnership program. Some of them, though, have also additionally registered with the state, but not all of them. So not all of the Walgreens and CVS and Costco's are included in that 650. You're right about that. That's a lot of them are providers, facilities, hospitals, county health departments. But we will be looking at implementing a number of strategies. So potentially expanding the mass vaccination pods so that there are lots of appointments that people can go to in addition to the CVS's and their doctor's offices and employer-based clinics. I think we learned from the testing situation, just like you said, it's better to have a multi-pronged approach and make sure that you have multiple venues that people can go to. And we want to make sure that we're being consistent with that statewide.
So operationally, some of those pharmacies could be involved in phase 1, not just phase 2 and phase 3.
Yes, that's what we're looking at, is bringing them in earlier than 2 or 3.
And you've had those conversations with them?
So the team has worked with Walgreens and CVS. I know CVS recently reached out specifically about trying to help with the frontline workers, the frontline healthcare workers. CDC has been working with them to make them available to states during the 1B phase. And so, yeah, those conversations are ongoing.
Thanks.
Next up is Benjamin Guggenheim.
Hi.
There you go.
Hello.
Hi.
Thank you for sharing this information today. I just wanted to ask, so from what I understand, the 314,750 doses are expected by the end of the week. Do you have a total number of doses that you can confirm the state has received already?
I would have to go back and just check with the team to make sure, to see if we've received all of those doses. Usually they come in Monday, Tuesday, or Wednesday, but if there were shipping issues, they may have gotten stuck. So I can have Steve follow up with you to let you know if they've all been received.
Okay, thank you.
You're welcome.
Okay. Trying to let Bud Foster ask a question, but I'm having some problems. I'm going to call on Dylan Rosenblatt first.
Hi, Dylan.
Hi, Dr. Chris. Thank you. So you mentioned how you have been talking with other counties on how to potentially roll out vaccinations at a more rapid pace than is currently going on. I'm curious what options there are. I know some have suggested a 24/7 situation. I don't know if that's something that's being considered. I'm curious just what these conversations have been like.
So the team has been having weekly conversations with our counties to identify the plans, identify what local allocators they want to do. Recently this week, as we've been looking at the data, we have been working to increase the vaccination. One, we don't want vaccine to be like stockpiled or to not be used. We want to get it into the arms of Arizonans. So things that we've talked about are expanding the different types of sites. So looking at getting it, like right now in Maricopa County, you have 5 sites. Could we expand that so that you're utilizing some of those smaller locations, but that can do high throughput like our FQHCs, additional hospitals that may not be part of the distribution pods. And so looking at those. Our 5 pods in Maricopa and our 2 pods in Pima are being run through the generosity of our healthcare systems. They are using healthcare staff that we want to make sure that we're using judiciously, but we will look at all options to see how we can increase access to vaccination.
Would you consider doing a 24/7 administration for vaccines at some locations, just to be able to, all hours of the day, if people don't have time, they can go like late at night and go get their vaccine if they're eligible at that point?
That would be something that we would look at in the future. I think we would have to see if any of our current healthcare sites were interested in doing that, or if they had the staffing ability to be able to do that, or what kind of resources they would need in order for us to be able to provide that service. I know that we do have testing sites statewide that have gone to 24/7, and I've heard a lot of positive comments about that, so it's always something to consider.
And then I just wanted to ask, I know anytime there's a vaccine, obviously this question has been asked before, curious about any side effects that either you have dealt with or anything from your vaccine, or that you've heard other people have been going through, if there's any major allergic reactions that have happened in the state, just any of the normal things that would happen.
Yeah, so for my own vaccine, I believe about 2 weeks out from getting vaccinated. The only thing I had was a little bit of a sore arm the next day. I haven't had any other side effects or issues based on that. And it was very similar to what I get with my annual flu shot. With the individuals that were vaccinated with me, I have not heard of any issues that they've experienced either. I know Dr. Goldberg has been very active on social media about his experience because he wanted people to be able to learn, through his experience. In Arizona, we are participating nationally in the VAERS report, which is the Vaccine Adverse Events Reporting System. And so through that, when events get put into VAERS, CDC notifies us. We've been notified of 7 reports that are non-serious within Arizona.
What does non-serious mean?
So a non-serious would include things like allergic reactions. It would include things like sore arms if somebody reported that, those types of things, not life-threatening, like that result in serious outcomes.
Okay, thank you.
Next is Matthew Galka.
Hello. I can't hear you.
You should be unmuting. There you
Oh,
go.
okay.
All right, can you hear me?
Yes, I can.
See me through my beautiful steering wheel here. So I know a lot of people have been asking about the numbers, basically the numbers of doses we have compared to the amount of shots we've actually given, anywhere from 18%, 20%, 22%. Regardless of where that number actually lands right now, that seems very low, and I know you kept saying, we're working with the counties, we're working with the counties. My question is, this isn't a demand issue, correct? I mean, the demand is there. I know there was some concern about vaccine hesitancy. So this isn't a demand issue, and then I'll just use Maricopa County as an example. If we had more than 5 pod sites right now, do you believe that number would be higher?
So those are great questions. I think if we had more sites that were available, I think we would be able to move people through a little bit quicker, but that also requires the staffing and the operational logistics to be able to do that. And I know that at the beginning, we really were trying to ensure that we were primarily getting those healthcare providers that are on the front lines and those first responders. So there were some additional steps that had been put into place that we've now opened that up to all healthcare providers. So I think that you'll start to see it speed up, and especially with the long-term care partnership starting this week, that will significantly increase the numbers as well. And I'm sorry, I forgot the first question.
Oh, demand. Have you seen the vaccine hesitancy fear, I guess, come true, or is the demand there? We just don't have the, I guess, logistics in place to supply the demand right now.
So there is demand. From what I understand, those that have filled out the pre-registration, like the pre-screening tool for Maricopa County and for Pima County, which are the two that have been operating the longest, they all now should have been scheduled for appointments if they made it past the screening. If providers haven't, we would direct them right now to the Maricopa County or Pima County website to redo the pre-screening phase. But it sounds like the majority of those that have submitted the pre-screening have been given appointments.
Thank you.
Welcome.
Josh Sanders is up next.
Hi, Josh.
Hi, Dr. Chris, can you hear me?
Yes.
Oh, happy holidays.
Happy holidays.
So you stated that the state has received 314,000 doses. 57,000 people have received their first dose. The governor's office says that the pace of the vaccine rollout is not going as quickly as they would like, and they said, quote, "The vaccine is not doing anyone good sitting in a refrigerator." And now that they've issued this executive order. Now look, Arizona is not alone. We're seeing kind of this trend across the country. But my question for you would be, surrounding this executive order. One, did you know about it heading into this presser? And two, would you agree now that a uniformed approach a statewide plan would improve the rollout? And could you again go over the kind of the nuts and bolts of what that plan looks like? And I do have a follow-up. I appreciate that.
Yeah, absolutely. When we look at the allocation, we agree with the governor's office, and I think everyone in public health agrees. We don't believe that vaccine sitting in a freezer does anybody good. We want it in people's arms. So we're going to continue to work. I think in order to ensure that we had the doses coming in, and some of that had to be held for the long-term care partnership, and this was the last week that we had the advanced notice, like to be able to plan. And so I know that the county health departments were carefully balancing having enough to make sure that you were getting those direct frontline healthcare workers vaccinated, with continuing to get the vaccine out as well. So I think as we expand, you're going to see significant increases in vaccine throughout Arizona. I do think that the local health departments need to have a say in where those doses go, because they do know their communities. But what we're seeing is that it's making it difficult for Arizonans to identify how to get vaccine, depending on if you're in Pinal County or if you're in Maricopa County or Pima. And also, you know, a lot of people don't live in the county that they work in, so that even makes it a little bit more confusing. So we do want to provide a standardized approach to providing the information about how and where to get vaccinated and when, so that Arizonans have one place to go to. And then working to expand those to those additional locations that we know we can work with as a statewide partner. I think that you'll start to see more cohesive information versus us referring like we do with almost everything else, such as restaurant inspections. We work so closely with our county health departments, and they are the boots on the ground, but you will see a more coordinated approach moving forward.
Okay, yeah, so the governor said currently each county having their own implementation plans, it's not working. This uniform approach, you want it to be a team effort though. You want there to be kind of county buy-in, but you're also listening, like you said, to what each county is experiencing right now. To your point, Yuma County, obviously, or Yuma and that area is very different and experiencing very different situation right now than Maricopa County. What would be your message right now, though, to those phase 1, phase 1A, phase 1B, and just the general public right now that is seeing our rising numbers, seeing our hospitals right now deal with challenges when it comes to bed capacity, the deaths are increasing as well. I mean, even Banner has a mobile ward right now, and that's just terrifying. What's your message to them? How do you kind of, calm, bring a sense of calm and reiterate that, hey, listen, we are here for you, and the steps that we are taking right now are the steps that we need to take in order to keep Arizona safe.
And those are all very good points. So I think that this is a team effort. This is not something that one county or one state can do alone. And so we really do need all hands on deck for this. I look optimistically at the vaccine. That is the light at the end of the tunnel, although it is still pretty far away. And it's going to be a while before we see the effects of vaccine. And we do know that it is actively circulating in our community. What I would encourage Arizonans to do is it's just a little bit longer, but we need everybody to take those very simple steps to avoid transmitting it to those that are high risk. While you may not think that it's high risk for yourself, you probably have a loved one who it is. So we need everyone to mask up and stay physically distanced when they are with people that they don't live with. Make sure that they stay home when they're sick and wash their hands and use hand sanitizer very frequently, because it is still going to be a number of months. And we know that is extremely hard during the holidays, but if we can get through the next couple of months, next year's holidays should look a lot more familiar than this year's holidays did.
One last question, Dr. Chris. Dr. Deanna Nguyen, a CNN analyst, had said at the current rate right now, across the country, 2 million have been vaccinated. But to get to that herd immunity that we need in 6 months next summer, which a lot of people are focusing on, we would need 3.5 million a day to be vaccinated. Are you optimistic that we will get there in Arizona by summer of 2021?
So we are optimistic. There's a lot of different things that have to come together for us to do that, but we are optimistic. And I think as you look over the next couple of weeks, as we continue to add locations, and as we continue to get more vaccine into the state, we're going to see significant increases in the amount of vaccination provided. And we will be able to meet that by the summer is what we're hoping. So.
Thank you.
You're welcome.
Allison Steinbach.
Hi, Allison.
Hi, how are you? Thanks for doing this.
Yeah, good.
So I just have a quick question. Where are we in terms of shifting to phase 1B? And also, what is the timeline for teachers being vaccinated? Do you think that will happen by March, say?
So we are anticipating moving into phase 1B at the mid to end of January. So looking at teachers and those that are 75 and older at the end of January, beginning of February, should start having access to vaccine. Now, what we're working with the county health departments to do is to make sure that doses aren't going wasted. So as they start to see the demand wane off of our phase 1A and have available appointments, to make sure that they're, bringing in some of those phase 1B as they're looking ahead with their appointments. So it could be earlier for some groups, depending on what jurisdiction. And we also know, Maricopa County obviously has the majority of healthcare workers in Arizona. And so it's going to take them longer to get through that than some of our more rural counties. And we know that our rural counties may enter into phase 1B sooner than Maricopa or Pima. And so we'll work with our counties to identify what phase they're in, and so that, people around the state can know where they are.
Okay. We have two more questions.
Okay.
This one is from Zach Crenshaw.
Hi, Zach.
Hey, Dr. Chris, can you hear me?
Yeah.
So my question kind of goes back to demand a little bit. I was at a long-term care facility yesterday when they were getting their first doses from Walgreens, and the director there told me that the opt-in rate of his staff was like 35 to 40%. And I know you did some polling earlier, and the numbers I think were surprising to a lot of people of how many young frontline healthcare workers, had some reticence. So I want to ask you two things. Number one, are you guys tracking at the state level the buy-in or opt-out rate of these frontline healthcare workers? That's part one. I'll ask the follow-up in a second.
Yeah, so one of the reporting requirements is the priority group that those individuals are in. And so we will be tracking what the uptake is and when we start to see demand decrease. I wouldn't be surprised, I think when we got our results from the poll, I think like doctors and nurses were very high on that. And then depending on what, where people worked, we did start to see a fall off of, just right away, yes, I'm gonna go get the vaccine. I think as people see more and more individuals, especially if they work with them or, they're people that they follow, get the vaccine and it's safe, they'll opt back in. One of the things that we assure everybody is even if you're a healthcare worker that is unsure right now, we would still encourage you to get vaccinated, but you don't lose your turn. So if you decide, and we've moved on to phase 1B, you are still eligible to get vaccine if you are an unvaccinated healthcare worker. Or if we're in phase 1C and you're a firefighter and didn't get it, you still will be able to do it. You don't lose your place in line.
Well, that makes sense. Do you have any initial data? I know it's only been about 2 weeks, but do you know what the current, buy-in rate is, for lack of a better word?
I'd have to take a look. I don't have that data offhand, but we can take a look and see if we've got some of that.
Gotcha. I guess anecdotally, when you hear 35 to 40%, and I think the number of people skeptical or reluctant between the ages of 18 and 35 based on the polling data you showed a couple weeks ago, does that concern you about the, reaching herd immunity and, what can be done to increase buy-in?
So we want as many people who can get vaccinated to get vaccinated. Right now, really trying to make sure that we hit a large number of healthcare providers because we want to protect them, but we also want to protect the patients that they're seeing. And then making sure that we hit those high-risk individuals so that we can protect them from becoming, hospitalized or even dying from that. It concerns me less that the younger population is putting it off a little bit just because while they are healthcare workers, not as likely to get some of those significant outcomes, and it does preserve some vaccine for those that are older, but we would want them as healthcare workers to get it. So I think it's really encouraging them and showing them that it is safe to take. I think it's just going to take a little bit.
Okay,
Okay, thank you.
Thank you.
and our last question is Matthew Casey.
Okay. Hi.
Hi, Dr. Chris. I was wondering, how long do you think it will take to implement the governor's executive order today? And what I mean by that is, when are we going to start to see a dent made in that number of vaccines received ratio to vaccines actually administered?
So my team is already engaging with some of the partners. We are in the process of developing the QA website so that all of that data can be posted on our website. And I know that they're starting on getting a vaccine finder just like we have for our testing. So we should start to see that likely at the beginning of next week, if not sooner. And then we will be looking to expand some of those location sites potentially as early as next week.
And then I've heard you mention in a few different answers, but if you could just kind of put it all into one, why is the ratio so bad of tests received vaccines received to vaccines administered?
So a lot of that has come in over the last week or two. Keep in mind that our rural counties did not get vaccine until last week, and so are really continuing to gear up to get more and more vaccine to additional providers. With those first few appointments, we were really trying to ensure that it was our frontline healthcare workers. So the pre-screening was a lot more intense to make sure that we were getting our emergency room docs, our ICU nurses, those primary care individuals who are going to see a lot of COVID patients, because we wanted to make sure that if we stopped getting vaccine and didn't get enough, that those frontline healthcare workers did. The other thing that we had to do was for several weeks take out some of the allocation to allocate it to the long-term care partnership. That had to start coming out of the December 20th doses, but they didn't start administering it until this week. And so you will start to see those numbers significantly increase as those programs get off the ground.
One final question, then thank you, Doctor. Phase 1B is going to include a lot of people who are undocumented, a lot of workers who are undocumented in the state. We know that there are about 100,000 people who would be considered essential frontline workers. What are the state's plans to reach that population and get them vaccinated? Because as we know, if everybody doesn't get the vaccine, the plan doesn't work.
That's very good, because that is one of our priority populations. We want to make sure that we're getting those essential workers that have to go to work and could be potentially exposed, and it's a large portion of our community. So what we will do is we are working with some partners to develop targeted communication to some of those high priority populations in order to ensure that they know that the vaccine is safe, that they have access to answers of the questions that they might have, and also community members who are willing to go get the vaccine and then talk about it to these specific targeted populations. So we'll be working to roll out those communication plans. That was part of, the healthcare worker data that I showed. We also did general population with high-risk groups targeted. And so we're developing the communication strategies to get it out.
Well, I know that right now you have to give your driver's license when you apply for pre-screening. Undocumented immigrants don't have driver's licenses. So what will be the workaround with that?
So there's a lot of different workarounds that they'll be able to do. They can either provide a driver's license, a work ID. We will not prohibit anybody just based on residence from getting vaccine. We always like to say vaccine doesn't know your state or country of residence. If you're in Arizona and you get sick, you are going to take up an Arizona hospital bed. It is in our best interest to preserve those hospital beds by vaccinating as many people as we can who are here in our community. And so we will find ways to reduce those barriers so that individuals have access to the vaccine.
Thank you, Doctor.
Yeah, absolutely.
And we've run out of questions. Thank you for joining us today, and as always, thank you, Dr. Christ.
Thank you, and I wish everyone a happy new year.